Good morning and welcome back. Today we have Dr. Jared Hudspeth, an orthopedic surgeon with Piedmont Orthopedics by OrthoAtlanta, joining us. Thank you for being here today.
Thanks for having me.
I'm excited to have you here. I have a few questions. I want to know, what are the most common shoulder injuries you see in athletes and active individuals? Tell me about that.
Yeah, I think there's two different types of injuries that we see, mostly young athletes. You may see different injury profile than our weekend warriors and our active individuals. So in athletes playing sports, oftentimes shoulder instability is the big one. And then older individuals that are still active typically have soft tissue injuries such as rotator cuffs or biceps problems.
Wow.
There's a lot of spectrum between there. But
And is that the most common you see?
yes, ma'am. I do think that's the most common things that we see and treat in our clinic are soft tissue injuries of the shoulder.
All right. And I want you to explain the difference between a rotator cuff tear and a shoulder impingement. What is the difference?
Yes, so they're kind of a spectrum of the same thing. Impingement is oftentimes where the rotator cuff tendons are intact, so they're still functional, but they're irritated or inflamed, and that causes pain. Whereas a rotator cuff tear is where the tendon is actually detached, and since it's a tendon, it's attached to muscle, and so once it detaches, everything wants to retract and move away from you, which can be a problem.
And what is that healing process like for each of those? How long does that take?
Yeah, good question. So impingement is just a self-limiting factor. Normally, things like therapy and medications oftentimes cure it, sometimes injections. Rotator cuff tears can't really heal on their own because they're, like I said, attached to a muscle on stretch. So once they tear, they start to pull away and move away from where they were originally attached.
Wow, that does not sound good at all. All right, so what are your top tips for preventing shoulder injuries both in athletes and for folks in everyday life? What do you recommend?
So I'd say the strongest tip would be just being aware of and knowing where your shoulders are at risk. The rotator cuff is engaged and being used most when your arms are away from your body. So when your elbows get away from your body or your hands get out and away from your peripheral vision, not in front of your body, those are the highest risk positions for people. So for an athlete, making a tackle in football when your arm's away, or landing, trying to catch a ball and your arms out over your head, those are risks. And then for other individuals, it's still when your arms get away from your body. Sometimes people lift up heavy things like luggage, simple traveling on an airline, to other sports activities. It's just when you get your hands away from your body. So
it starts getting a little tricky.
Yes.
All right, so definitely be careful for that. Now, when should someone see an orthopedic specialist for shoulder pain rather than waiting it out or self-treating? What do you recommend?
Yeah, I don't think it's ever, a problem to begin to self-treat and see if it happens unless you know that you had a major injury, a traumatic injury, we would say. But the biggest thing would be if you're having weakness and continued symptoms despite trying the easy things that everybody's going to try. And that can be a sign that you have a rotator cuff tear that's not improving. And the problem with ignoring or missing a rotator cuff tear is that it won't heal on its own, and we can't fix it sometimes if we wait too long. And so it's a fine line of trying to get yourself better without needing us, which is great. I understand that. I would try the same thing myself, but then also understanding and knowing what the problem is. So I hear it all the time, or see it all the time, where someone had an injury and they said, I couldn't lift my arm for a few days or a week or so, and then it got better, so I didn't come in. And then a few years later they come in, and it's a much different scenario than if they would have seen us the first time. We could have caught it and probably provided more options for them.
All right, now lastly, how do advancements in arthroscopic shoulder surgery impact patients' recovery times and long-term outcomes? Can you kind of speak to that?
Yeah, so the arthroscopic is minimally invasive, so small poke hole surgery to go in and try to limit the damage that we do to be able to fix things. And so I think that technology has been around for a while and will continue to be the mainstay. But we do have a lot of technology around biologics, so things that kind of help the body start the healing process and complete the healing process. So when we have to intervene, our goal is to intervene to then allow the body to do the healing, and only until that happens. And so the biologics, there's things like patches that we can add, or even special types of suture that are being developed that help stimulate the healing as opposed to just us intervening.
All right, well, thank you for that. To find out more, head on over to our website, 41nbc.com.